Welcome to your postpartum care practice. So I say care and not core because we're going to talk about how to care and reconnect to your core postpartum. I personally know how overwhelming it can be in those early days, weeks, months even postpartum when you're trying to Google and figure out what is safe and what is not safe for your postpartum body. So I'm here to make it easy for you. I've created a very simple postpartum care sequence that you can practice whenever you feel that urge to start moving again. We'll talk about core activation and how to build up those movements and how to know when you're ready to build up those movements. This is from a yoga perspective, but they're physio approved exercises. My name is Bethany. I have been teaching yoga full-time for the past 10 years, and I specialize in working with pregnant and postpartum women. I have 2 young kids, the youngest being 1.5, and after each birth, I have come back stronger than I was before. So that's my hope for you, that you can take this practice, you can start practicing so that you can find your way to find your strength and your confidence with movement postpartum. No crunches, no sit-ups, but finding that deep activation and building from there. Moving onto your back with your knees bent, and we'll just start by dropping our knees side to side. So just relaxing through your low back. You can rest your hands wherever it's comfortable, really. Maybe you've had a busy day, so it can be nice just to pause and breathe. So let's find that breath, deep breath in through your nose. Exhale through the mouth. Once more. Okay, come to center. Step your heels in closer, feet hip distance, and bring your hands to your lower belly. Shoulders are soft, and start to guide your breath to your belly. Breathing in, belly fills. Breathing out, belly softens. One more round. And then see if you can tuck your pelvis just slightly so your low back presses down to the mat. And then start to breathe into your belly, but also back down to your back. Expanding the breath. And on your exhale, start to draw the belly in and lift up through your pelvic floor. So breathing in, expanding, breathing out, drawing up, engaging. And as you move like this, you can keep your hands on your belly. Or a great tip that I got from my physiotherapist is to bring your fingers to the inside points of your pelvis. So you feel at the top of your pelvis, and you bring your hands right on the inside there. And see as you breathe out, if you can start to engage your deep core muscles, our transverse abdominals here. So maybe you feel a little bit of a tightening here on those exhales when you're engaging, drawing the lower belly in and lifting up through your pelvic floor. So breathing in, belly softens, pelvic floor relaxes. Breathing out, we're drawing up and in. So finding that activation. And especially in those first early days postpartum, this can be really challenging. You would think, yeah, okay, it's easy to find my core, but you'd be surprised when I work with women in person, we struggle to reconnect to the core, and that's okay. But just in those early days, maybe this is all you do. Just breathing, belly expands. Exhaling, belly starts to tighten, pelvic floor engages. So we're working with this mind-muscle connection, okay? Let's do one more round. And just relax your belly, lift your knees up. And we'll circle our knees here, massaging the low back. This helps release any gripping, Maybe the pose, the movement before was challenging. So this is nice to release, okay? And then we'll set up again with our next step for core activation. And we want to have our feet down on the floor. So I'm just going to tuck my mat underneath me just a little bit so that I can have my feet on the floor. And that feels really nice for my low back. I can recommend it. But now we'll start to train the core. So we've activated with our breath. Now let's start with the first exercise that you can start to reconnect and train your core. So we'll have the same setup. The heels are pressed in close, feet hip distance, and your hands can rest on your belly or even your fingers poking down on the insides of your pelvis, okay? And then what we'll do is just start to find that breath. Take a breath in, belly expands. And as you exhale, drawing up and in, deep core is engaging. And then find a slight pelvic tilt. Keep that engagement and just slide your right foot out. Maybe just a few centimeters until you feel like, oh, nope, I'm losing that connection. Then you come back in. You can relax. Do this again. Find that connection if you lost it. And then extend the foot out again. If you keep the engagement and it feels good, you can take 5 rounds here. Breathing. Maybe if you're a little further postpartum, maybe you can extend the foot all the way out, but we keep that deep engagement and back in. And then same thing, relax, and we do the other side. Breathing in, breathing out, engaging, and then extending the foot out. Maybe just a few centimeters, keeping that deep core. We don't want any coning in the belly. And then we just do 5 slow rounds. And 5. Back in, relax, relax the knees side to side. And then bring the knees back to center. Lift your knees up over your hips. And you want your shins to be about parallel to the floor. Now, even as I move my legs up here, I start to feel this is a little challenging. My core has to activate to stabilize here. The hip flexors are working a bit and the core. Want to find a slight pelvic tilt, finding those deep core muscles. And this is option 1. You stay here. If you feel like, okay, no, I'm a few months postpartum, I want to find my core a little more, then you can move with me. But otherwise, just stay here, hold this for a few breaths. But to find a deeper connection, we drop the right toes down towards the floor and then bring them up. Try to keep the other leg still dropping down. You can hold a hand here if you'd like. And I like to move through these movements with keeping a hand on my belly just to help to avoid any coning. I can feel if my belly starts to bulge. We just do 2 more. And then back up. We'll take a pause, feet down. It's quite intense, and I'm a 1.5 years postpartum. So these movements are so simple, but they really are so powerful. Often we think that we have to do the crunches and these really intense movements to connect to our core, but really to find these deep core muscles, we move very little, just all about that mind-muscle connection, okay? Now let's find that pelvic tilt again, deep core engaged. Lift your knees up again, bringing your shins about parallel, making sure the rib cage isn't flaring out so the core is really active. And then work with the left leg. Take a breath in. Core is strong, toes lower down, exhaling. And back up. Lowering. We're breathing here, easy breaths. And just focus on keeping that connection. Again, for the second round, if this adds bulging to your belly, you want to skip this. And you just keep your shins parallel to the mat and hold this pose. You'll feel it, I promise. You can have a hand on the other knee. And let's just do 1 more. And back up. Hug your knees into your chest and rock side to side. Now, this is a really simple, quick sequence. If you have more time, you can go back and do each exercise another 2 times, okay? So now we've done the slides, we've done the toe taps. And then now I'd like you to keep your feet on the ground, hands alongside your body, press down with your palms, find that pelvic tilt, core engaged, and then lift your hips, find our bridge pose. Chin slightly to your chest, neck is long, and lower back down. Find that tilt, core strong, lift your hips, and lower down. Breathing in and out. Last round. Strong core. And then lower back down. All right, now come over to all fours. You can keep your mat folded and come over to bring your knees onto the mat. Okay, so very similar to what we were doing before, but now we're in a tabletop. Let's find cat-cow just to release, lifting your chest forward, look up, tailbone lifts, and then round, tuck the tailbone under, looking down. Breathing in, lift the chest. And exhale, round. Then come back to center, pause. And then here, see if you can start to find that deep core again. It's harder in this pose because you don't have the mat behind you. But sometimes I like to put a hand on my low back to see, okay, can I find length through my spine? So I'm not rounding here, but I'm finding this nice long spine here. My deep core is engaging. You can take a hand on your belly to see if you have any bulging here. We don't want to strain the core. And honestly, if you're in the first weeks postpartum, you can stay, hold this for 3 breaths, and then you take child's pose, okay? Or if you'd like to challenge your core a little bit more, maybe you're a few months postpartum, you tuck the toes, core is strong, spine is long, and we lift the knees. Take a breath in, a breath out. One more. And then lower down. Child's pose, release, relax your belly. Come down for a breath. And then back up, inhale, tabletop. And then stretch the right toes back. Here in this pose, we often lift the hip, but we don't want that. Square your hips towards the floor. Deep core is engaged. Press away with your hands, okay? And then this is a lot of work to keep the belly from bulging, this core is strong, and we rock forward and back. This is our step 1, just finding that deep core activation. If maybe you're a few months postpartum, you come forward, keep the core strong, and you lift the foot up. Keep the hips square to the floor and lower down. And we do that 4 more times, lifting and lowering. 3 more. And lower. And lower. Last round. And lower. Knees down. Circle the hips to release. All right. Other side. Come back up. Tabletop. Finding that length in your spine and extend. Now the left toe is out. Gaze is slightly forward of your hands. Dropping your hip down. You can do a belly check for bulging. And we start to rock forward and back here. This is a great place to start. This feels challenging for my body even because we're working in such a slow and focused way. And then you can move forward, weight onto the hands, lift the foot up. Find that engagement again, don't lose it. And then lower back down. You take 4 more, lifting and lowering. 3, 2, and 1. Bring the knee down. Tuck the toes. Downward facing dog. Down dog. Relax your head. Relax your shoulders. You can bend one knee at a time, stretching through your legs. Full breath in. Full breath out. And then slowly lower your knees back down to the mat. Last exercise here. Press away from the floor. Core is strong, spine is long, and extend the right toes out. Option, same thing we did before. If you'd like, core is strong, or you lift the foot, or you find balance, extend out. This is challenging. To do this properly, I see this in my yoga classes all the time, especially in like a typical vinyasa class. People move into this pose, but they're actually not finding the right body connection. So here we're gonna do it the right way. So if you feel any bulging in your belly, you back out. If it feels okay, you can pull an elbow to knee. If you're early postpartum, a few weeks, you stay in the pose from before. But if you're a few months and you want to start to find a little deeper connection, you can try this, but move as slow as you'd like. Last one, we don't do many. Extending out and back down, tabletop. Come down to your forearms, relax your palms up. Make a fist and release. You can rock your hips as you do this. Fist and release. Last one. And release. Hands back down, come back up. Tabletop, find that deep core. And extend, now the left toe is out. Strong core, hips square to the mat. And extend and lift, coming into that nice long extension. Take a breath in, stay here, or pull an elbow to knee. We don't do many, just 2 more. Inhale, find that length. Exhale, pull it in, maybe tucking your chin in more than me. 1 more. Drawing in. Find length. Back to center. And child's pose. Take a breath in. A breath out. And if you have the time, do the whole circuit twice more. But if not, this is an amazing place just to pause, connect to your core, and start to reactivate that mind-body connection. Enjoy.